Good morning, Vikram.
Good morning, doctor.
Thank you for coming over. You have been with us for a few months now, and we just wanted you to share your experience, what you have been treated for, what have you been experienced, the result, the outcome, so that the other public can know and benefit from your experience.
Sure.
So, if we start from the beginning, tell us how long you've suffered with this problem.
Since my mid-20s, so probably around 8-9 years now. I first started to notice that I was thinning around 25, 26. But it's got significantly thinner in the past 2 years. I think it's kind of been more progressive. But definitely since around 25, 26 years old.
So, what was your first reaction when you started noticing hair in your shower and all that?
Fear, because you start thinking you're going to lose all your hair and everything. So it was definitely a thing of a cause of concern for me. I was definitely very worried. So yeah, it scared me to take some action, definitely.
So, what did you do?
Usual things, standard things that people do, use oils, took vitamin supplements, also tried a lot of serums and shampoos.
Dr. Google?
Dr. Google, yes. I Googled things I could do precisely that, and it just kind of came up with those suggestions and products and things. So I tried lots of things over the years.
Did it work?
I don't think so, no, but it's one of those things you don't know until you try, right? So I just tried those different things, and maybe some of it did work, maybe it would have been worse if I didn't try those things, but I don't think, I wouldn't recommend them to somebody else if that's what you're asking.
Right, okay. You must have spent some fortune on that.
Yes, probably a lot of money over the years, definitely trying different products and trying different things.
So how did you end up at Javaani? How did you find us?
I was actively looking for a clinic to visit. I was also thinking about visiting a doctor. I googled some local clinics to me. Also, I was getting a lot of ads on Instagram, and one of the ads was yours. So I googled the clinic to find out more, and was pleased to know that it's a doctor-led clinic. So I gave you guys a call, spoke with somebody who asked me those questions, similar to how you just done about my history and what I've been experiencing. And we booked in a consultation, and I came to see you.
Okay. But was it easy? The process was easy to come and see me, and
Yeah, very easy. Quite seamless from picking up the phone and being booked in almost immediately, and coming to see you. It was quite seamless. No complaints on that.
good. So how was the plan devised for you? What were the things taken into consideration when the plan was given to you?
I remember you asking me different questions about general health. Of course, as a doctor, you kind of took me through those steps. You analysed my scalp. Had a quick look at that to see if there's anything that I should be treating outside of just taking some treatments and things. If there was any other concerns. And then the second time we met, you had a plan for me. So you had the steps I should take. 2 or 3 kind of routes I could take to take some action and stop the hair loss. And it was quite in depth. I remember. Those are different options, so those definitely things to try.
I would like to just take what you have said forward.
Yeah.
That when we go into consultation, we have to look at all the aspects of the person coming in for consultation.
Yes.
For example, what is the medical history like? Is the person taking any other medication?
Yeah.
How long they suffered with that hair loss? Everything matters. Is there a significant family history of hair loss or not? How is the scalp? That's where the examination comes in.
Yeah.
You just cannot not review the patient, cannot examine the patient and just devise a plan. You have to look at all these aspects. For example, people coming in, if they're suffering with straight dandruff, you cannot start treatment for hair loss without clearing the scalp. So that's why we have to examine. We have to take the medical history, take all other things into consideration before devising a plan. And that's what the target was, and that's what we took it and devised a plan for you. So can you tell me what different treatment modalities were offered to you?
So the very first one was PRP, which I had a few sessions of, followed by some therapy. and then we did some microneedling. Had some experience actually. One of the things I had some experience with was microneedling. I had the small handles that you can get for home use, so I tried them. But the microneedling that I had done by Javaani was a lot more professional, as it would be, and that was very different to what I was doing at home.
And again, I would like to add that the microneedling which you can do at home, first of all, you cannot do more than 0.5 millimeters.
Correct.
That's the regulation. You cannot do. Why? Because it's not safe. And secondly, the device which we use professionally, they are meant for deeper penetration. So if required, I'll go even more than 1 millimeter, even more than 1.5 meters. But to do that, you have to be in a clinical setting. You have to be in safe hands. The person who is doing it should be confident and should know what he is doing.
Yes.
So that's what we did for you, and I'm glad we got the results.
Yeah, I agree.
Right. So roughly it took you about 6 months, I believe.
Yeah, if not a little bit more than 6 months since I first met you to today, and the treatments in between. It has been around that long.
Okay. Just summarize. What is how you feel your hair growth now?
I would say that the crown has got a lot narrower. That's really the area where
The visible area.
The visible area. That's really the area that was the most visible. And also around the hairline, I had some loss, and I think I've recovered a bit more on the left side. And also to touch, just generally, touching the scalp, I can feel the scalp a little less than I could before the treatment. So I think those are positive signs that definitely something is working.
Has it been noticed by family, friends?
Yes, people have actually definitely made comments and said the hair looks thicker, and quite encouraged by the treatments I've been taking. So definitely, if other people are noticing it, then something must have changed.
And that must have boosted your confidence.
Definitely, absolutely. Yeah.
How did you find the setup of our clinic?
Amazing. I really like it. When I came in, they say the first impression is always the lasting impression, right? So I think what I saw, it looks very professional, very clean, and I really like the atmosphere. It's quite calm and quite spa-like. So I was very impressed by the setup.
Thank you. Right. So would you recommend Javaani to others?
For sure. I think, even aside from treatments, I think just coming to see a doctor, I felt a lot safer than I would go into any other clinic which didn't have a doctor. Just like you explained a couple of minutes ago, the procedure that you took to analyze my scalp and think about my health, and those are things I didn't even think of myself when I was trying to cure myself from hair loss. So it was very encouraging to come and see you, and the detail that you looked into to find out if there could be anything else wrong that we need to diagnose. So I definitely would recommend. I think people who are suffering from hair loss, or even if it's slight or even if it's severe, I think they should come and see you for at least peace of mind to find out what's going on and some suggestions.
I'm so happy for you, Vikram.
Thank you.
You are pleased, but
yes.
I'm pleased as a physician because it's very satisfying to see positive results from the treatment. But I would like to say that the aggressive phase of treatment ends here, but the maintenance treatment should continue. Because hair loss is not a condition which is cured. We have to control it. We have managed to reverse it to some extent. Now we have to maintain the effect. So we'll continue with maintenance therapy. Again, I'll be monitoring your hair growth. I'll be maintaining the results of that. And as and when required, I'll be making some changes as well. But it will never be as aggressive as we have had the treatment in the last 6 months. So it might be just one treatment every few months, and it should be fine for you.
Sure.
All right?
Great. Thank you.
Thank you very much.
Thank you so much. Thank you.